How to stay hydrated after surgery with swallowing difficulty. Have you or someone you know recently had surgery and is struggling with swallowing? This can be a tough situation, especially when it comes to staying hydrated. Let's talk about how to manage hydration safely after surgery, particularly if swallowing is a challenge. After surgery, especially if it involved the throat or esophagus, some patients may experience difficulty swallowing, which is known as dysphagia. This makes it essential to be cautious about how you drink fluids to avoid choking or aspiration, which is when fluid enters the lungs. First, always make sure to sit upright or at least at a 90-degree angle when drinking. This position helps gravity assist with swallowing and reduces the risk of fluids going down the wrong way. Next, consider the consistency of the fluids you are consuming. Thickened liquids, such as nectar-thick or honey-thick fluids, are often recommended. These types of fluids flow more slowly and can help reduce the chance of aspiration. If you find that thin liquids cause you to cough or choke, it is best to avoid them. Taking small, controlled sips is another effective strategy. Large gulps can lead to fatigue and make swallowing harder. By taking smaller sips, you can maintain better control over the swallowing process. It is also wise to avoid using straws unless your healthcare provider suggests them. Straws can sometimes lead to swallowing too quickly or in an uncontrolled manner. If you have access to a speech-language pathologist, they can teach you specific swallowing techniques. For example, the chin tuck maneuver, where you tuck your chin toward your chest while swallowing, can improve safety and efficiency. Creating a distraction-free environment while drinking can also help. A calm and quiet setting allows you to focus on swallowing safely without interruptions. Incorporating hydrating foods into your diet can be beneficial as well. Foods with high water content, such as soups, smoothies, yogurt, and pureed fruits, can supplement your fluid intake while being easier to swallow. Don't hesitate to seek professional support. A team that includes speech-language pathologists and dietitians can assess your swallowing function. They can recommend personalized fluid thickness and swallowing exercises tailored to your needs. If swallowing fluids becomes unsafe or insufficient, alternative hydration methods may be necessary. Feeding tubes, such as nasogastric or gastrostomy tubes, can be used temporarily or for a longer duration to maintain hydration and nutrition. Lastly, keep an eye out for signs of dehydration or aspiration. Symptoms like coughing during or after drinking, chest discomfort, fever, or reduced urine output should be reported to your healthcare provider right away. By following these steps, you can stay hydrated safely after surgery, supporting your physical healing and recovery. Always consult your healthcare team for advice tailored to your specific situation.